Are microglia key to understanding CFS as a neuroimmune disorder? Imagine your brain as a busy city with tiny security guards patrolling constantly. These guards are called microglia, and they're the brain's main immune cells. They help protect your brain from infections, injuries, and other threats. When they detect a problem, they spring into action, releasing substances that cause inflammation. This process is normal and helps your brain heal, but sometimes it can go awry. In conditions like chronic fatigue syndrome or myalgic encephalomyelitis, microglia seem to play a big role. Research shows that in people with CFS or ME, microglia can become overactive or dysfunctional. This overactivation leads to ongoing neuroinflammation, which is inflammation in the brain. Neuroinflammation can interfere with how your brain works, causing symptoms like extreme fatigue, difficulty concentrating, muscle pain, and even sleep problems. Scientists have used advanced brain imaging techniques to look inside the brains of people with CFS or ME. These studies often find signs of abnormal microglial activity. When microglia stay activated for too long, they can damage nearby cells and disrupt normal brain functions. This might explain why many people with CFS or ME experience persistent neurological symptoms. But microglia are just part of a larger network called neuroglia, which includes other support cells like astrocytes and oligodendrocytes. When this entire network isn't working properly, it can affect blood flow in the brain, the integrity of the blood-brain barrier, and how nerve signals are transmitted. These issues can contribute to the complex symptoms seen in CFS or ME, especially after viral infections or stress. Microglial activation in CFS or ME might be triggered by infections, stress, or even genetic factors. Once activated, microglia can become hypersensitive, overreacting to signals of stress or damage. This creates a cycle where inflammation persists, making symptoms worse. Microglia also interact with other immune cells and influence neurotransmitter systems, such as serotonin, which can affect mood and pain levels. While research is still ongoing, some treatments aimed at calming microglia are being explored. For example, low-dose naltrexone has shown promise in reducing symptoms in related conditions like fibromyalgia, and it might have potential for CFS or ME as well. However, these are early days, and more studies are needed to confirm their effectiveness and safety. In summary, microglia are a key piece of the puzzle in understanding CFS or ME as a neuroimmune disorder. Their activation and dysfunction seem to contribute significantly to the neuroinflammation and neurological symptoms that many patients experience. Ongoing research into microglial mechanisms offers hope for new, targeted therapies in the future. But it's important to remember that each person's experience with CFS or ME can be different, and anyone dealing with these symptoms should work closely with healthcare professionals to find the best approach for their individual needs.